The CDC is now trying to calm fears that the disease can spread here. Our chief medical correspondent, Dr. Jon LaPook, is with us. Good morning, doctor.
Good morning.
Why bring the Ebola virus here to the U.S.? Is it dangerous?
Nora, it sounds like their condition is deteriorating, and there's medical care that can be given here in the sophisticated health settings that we have here that just can't be done in Africa. For example, one of the complications is that there's problems with clotting and you have bleeding. And here you could give fresh frozen plasma, other clotting factors. So that's something that's available here, more sophisticated treatment.
They're doing this to save these two health workers' lives.
Yeah, this is very dramatic, and I know people are concerned, is it safe to bring it here? But I've been told by the CDC that these are in very isolated pods that they're transported in, and that there's a very strict protocol that makes it safe.
And let's talk about that, John, because this unit inside this hospital is one of only 4 in the country. What is it like inside there?
There are 3 beds, and it's isolated. The air supply is isolated. The air is filtered. The staff is specially trained. So this is something that they've prepared for, and the idea is to keep them in this isolated area where it's safe. It can't be spread anywhere else, but where they can give it the best care possible.
And what kind of experimental vaccines do we have here in the U.S.?
There are things that are being worked on. I've heard
the NIH?
the NIH has a vaccine that's going to go into phase 1. That's the first phase of testing it in September. There are other things. There are cocktails of drugs. For example, 2 drugs that treat the virus and then combine that with a vaccine. This would be given after somebody's exposed. But these are all, not available for prime time anytime really soon.
All right, John, thank you. And I know you'll be back in the next hour with some of the myths about contracting Ebola. Thank you so much. And people have many important questions about the Ebola virus. You can find answers this morning on CBSNews.com, where there is up-to-date information from the CDC and the World Health Organization.